Now Dr. John LaPook on assignment for 60 Minutes.
With a new strain of COVID on the rise and flu season just getting started, we thought now would be a good time to consider what the pandemic has taught us about preventing the spread of potentially deadly respiratory infections. It turns out viruses like the one that causes COVID-19 can travel through the air much farther than 6 feet. So public health advice focusing on social distancing, hand washing, and masking wasn't enough. Air quality scientists say from the start of the pandemic, it also should have focused on improving the air we all breathe indoors. Now, some companies are doing just that for the health of their workers and the health of their bottom line.
The story will continue in a moment.
The original sin of the pandemic was the failure to recognize airborne transmission.
Professor Joe Allen of Harvard's T.H. Chan School of Public Health believes the rapid spread of COVID in early 2020 was preventable.
Think about the public health gains we've made over the past 100 years. We've made improvements to water quality, outdoor air pollution, our food safety. We've made improvements to sanitation, absolute basics of public health. Where has indoor air been in that conversation? It's totally forgotten about. And the pandemic showed what a glaring mistake that was.
What do you think was lost because of that lag in understanding of how this was spread?
Tens of thousands of lives in the US, many more globally. Not an exaggeration.
It's also no exaggeration to say those early days of COVID were unforgettable. In the US, by March 2020, the virus began taking its toll in places like the Life Care Center nursing home in Kirkland, Washington. 60 miles away in Mount Vernon, Washington, the Skagit Valley Chorale held one of its weekly rehearsals in a church. Half the members stayed away, but the other half showed up. Among them were board members Debbie Amos, Mark and Ruth Backlund, and Koisi Bettinger.
We just thought hand sanitizer, wash your hands a lot, don't hug each other because that's touch.
None of it was good enough. Within a few days, chorale members began to get sick. In all, COVID hit 53 of the 61 people there that night. 2 of them, both in their 80s, died.
We were going, this has got to be spread some other way because we were good. We were good.
So COVID was percolating, and you thought you were doing everything you were supposed to do.
Yes.
Right.
Skagit County health officials said the rehearsal could be considered a superspreading event, one of the earliest in the country, and concluded that choir members had an intense and prolonged exposure to surfaces, droplets, and possibly even microscopic airborne particles called aerosols containing the virus. That caught the attention of Lindsay Marr, a Virginia Tech University professor specializing in aerosol science, and several of her fellow researchers. Even though the medical community was focused on droplets, surfaces, and hand washing, these researchers strongly believed COVID was mostly an airborne disease, but needed more proof, so they launched their own analysis.
I thought, wow, this is even worse than I thought. This has to be airborne. There's really no other explanation for it. Some people are going to say, oh, they all touch the same doorknob, but after the first few people touch that doorknob, there's no more virus left. That's what happens with our exhaled breath. Now,
Professor Marr used a portable fogger to help explain how so many choir members could have gotten sick.
When they're singing, they are releasing virus particles into the air constantly, probably, like this. And those are going to drift around in the room. Notice they're not just falling to the ground. And now, as we continue to sing, there's more and more of them in the room. And you can see as they're drifting around, they're reaching these other people nearby. And they were there for 2.5 hours. And you can imagine that after that amount of time, the other people would have breathed in enough of them to get sick themselves.
Especially if at night the HVAC system was turned off.
As far as we know, it wasn't running, and so there was very poor ventilation in that room when this was all happening.
An HVAC unit, short for heating, ventilation, and air conditioning, is the heart and lungs of any building. The researchers suspected the thermostat most likely shut off the HVAC unit because the chorale members were generating enough heat on their own.
And right now, There's no ventilation.
Very, very low.
Okay.
And actually, it's similar to what was in the church where the group was rehearsing.
Then, Professor Marr turned up the circulation to show us how better airflow could have helped remove aerosols and slow the spread of virus.
Instead of just drifting all over the room,
Oh,
you can actually see it, right, going
I
up through
sure
there.
can. That is dramatic to see that.
The analysis led to one of the most significant papers on the importance of ventilation published during the pandemic. Then, last year, a study in Italy went further. It found that by using a school's fans and air ducts to mechanically exchange indoor air with outdoor air 5 times an hour, the risk of COVID-19 infections decreased by at least 80%. But in the U.S., it took until this past May for the CDC to recommend an air exchange rate at all.
If you look at the way we design and operate buildings, and I mean offices, schools, local coffee shop, we haven't designed for health. We have bare minimum standards. In schools, the minimum air change by design is about 3 air changes per hour. And remember, we want at least 4 to 6.
If we'd had these indoor air quality targets before the pandemic, how do you think the pandemic would have unfolded differently?
We still would have had spread. This isn't an end the pandemic thing. We would have had a lot less of it, and we would have had a lot less of these super spreading events. Think about the early days of the pandemic with flatten the curve, stay home. Why wasn't improved indoor air quality part of flatten the curve? We had tools to protect ourselves. Masking, great tool. It's a filter. But we ignored the building side of this. So, air in.
Buildings are Alan's business. As the founder of Harvard's Healthy Buildings program, he diagnoses problems in air quality systems and comes up with solutions for clients that include CBS's parent company, Paramount, and commercial real estate companies like Beacon Capital Partners, with buildings like this one in downtown Boston. And he advised Amazon before these new 22-story towers opened last May in Arlington, Virginia, where he gave us a tour.
What does a state-of-the-art building look like in terms of air?
Well, you see a lot of the elements in this building. You have a dedicated outdoor air system that's delivering air above the minimum requirements. Then it's going through 2 MERV 13 filter banks, and you have highly filtered air.
MERV stands for Minimum Efficiency Reporting Value. A rating of 13 means it catches up to 90% of airborne particles, depending on their size, as the first line of defense, not just against COVID, but other airborne respiratory viruses like flu and RSV.
This is the part of the building nobody ever sees, but this determines whether or not you're healthy or sick in the building. Really, what happens in this space. You can just see the filters on the right here.
At Amazon's new offices, the top floor is a maze of motors, pipes, and air ducts.
This is the air intake.
Part of a $2.5 million HVAC system that begins with massive rooftop vents and dampers.
Right here, this is the whole air handling system. This is where the air comes into the building, it's filtered, it's cooled, and then delivered. This determines how much air actually reaches the office space where people are working and how clean that air is.
Downstairs, each floor has a sensor that tells building engineers about the quality of the indoor air, such as levels of carbon dioxide, known as CO2.
We breathe out the carbon dioxide.
That's right.
The less carbon dioxide, the better the ventilation.
Really straightforward. High carbon dioxide means you're not getting enough outdoor air from that system we just looked at. If it's low, you're in good shape. Then we also measure particles. That tells us things about like outdoor air pollution.
The entire system can be monitored and controlled from the basement.
Remember we talked about carbon dioxide as an indicator for ventilation? Well, I can see in this building, all of these are under 800 parts per million.
So that's good.
That's great and really important. If a lot of people went into a space, the CO2 level would rise, this system would recognize it, the dampers would open up and bring in a lot more outdoor air.
Katie Hughes, Amazon's Director of Health and Safety, pointed to the waves of wildfire smoke that have swept down from Canada as the ultimate test of the indoor air quality system.
Not too long ago, Washington and Virginia were sort of smothered by this smoke coming down from Canada. What happened in this building?
You would expect the air quality within the facility to not be great. Our buildings were performing very well.
Hughes says Amazon has been updating many of its HVAC systems, including in its warehouses. A recent survey of facility managers in the U.S. and Canada found that since March 2020, Roughly 2/3 of respondents have upgraded their MERV filters and increased their air exchange rates. In New York City, J.P. Morgan Chase says its new headquarters will have state-of-the-art air quality controls. And this new skyscraper, called One Vanderbilt, already runs a modern HVAC system.
COVID shifted everybody's mindset in terms of air quality, in terms of communicable or infectious diseases.
Are you finding that Amazon is making a business decision, partially, by saying, look, it's okay for you to come back to work because we're telling you that the air inside this building is safe?
I think it's one of many reasons why we expect or would like people back in the office. That is a good thing to have. It's probably one of many things.
A well-operating HVAC system is not only good for the health of employees, it can be good for the health of companies too, especially with people working remotely, leaving many commercial building owners looking for tenants.
There's empty office space in New York City and elsewhere. How do you think this new thinking might affect that in terms of people even wanting to come to work?
The dynamic has changed. It's a total buyer's or tenant's market. All else equal, which building are you going to go to? You have your choice right now. This building that put in healthy building controls, or this building that's designed the way we've always designed buildings and is prone to being a sick building.
So it actually can help the bottom line, in addition to, of course, improving health.
Yeah,
What about retrofitting a building that's old?
I think it's a misconception that old buildings can't be healthy buildings. Some of these fixes don't take much. Improving the level of filtration, that's easy, it's cheap, protects against COVID-19, influenza, also protects against wildfire smoke and outdoor air pollution, protects against allergens. Simple, absolute basic things that can be done.
The Skagit Valley Chorale rehearsals are now in a different church with a new HVAC system. Doors stay open to bring in fresh air, regardless of the season. And there are even portable carbon dioxide monitors to track ventilation.
We've been through a traumatic experience, and we've tried to learn from that and did help the science with the aerosol study, and now we're moving on in a way that we can still sing, but in a more safe manner.
Do you worry that when the spotlight of the pandemic starts to fade, that people will forget and that they won't act the way they should in terms of buildings?
I'm a bit more optimistic than that. I think there are fundamental shifts that have happened. The scientific and medical literature is being rewritten. The government and standard-setting bodies are setting new health-based standards. Businesses are responding and won't forget what this meant to their employees' health and their business. So I don't think we're going to forget these lessons. We better not.
What we know now about the effectiveness of masking
Masks, even cloth masks, do something.
at 60minutesovertime.com.